For all those young males who are suffering from prominent breasts, this is the video for you. We are talking about gynecomastia. I'm Dr. Rajesh Vasu, plastic surgeon at Star Hospitals at Hyderabad. Gynecomastia, as the name suggests, is nothing but prominent breasts, and that's why it's called gynecomastia or male boobs. Now, gynecomastia can affect both the sides of the breast. It can be bilateral, that means affecting both the sides. It can be unilateral, affecting only one breast, and there can be an asymmetric involvement or even a symmetrical involvement of the breast. Now, why does it happen? There can be physiological reasons, and there can also be some medical issues which causes these prominent breasts. So we're talking about physiological reasons. It happens in three phases of one's life. It can happen during infancy, as soon as the child is born. It can happen during the teenage years, or it could happen even in the late 50s and 60s. Now, why does it happen during the infancy? Infancy, once the child is born, because of the estrogen dominance, because of the hormones being passed from the mother, there could be a prominence of the breast gland, and usually after maybe around 3 to 4 weeks, it resolves. Now again, during teenage period, the breast can form because of imbalance in the hormones between the estrogen and the testosterone, and again there can be a prominent breast tissue which is giving rise to gynecomastia. And similarly, in the later age groups, like in the 50s and the 60s, also there can be some amount of hormonal variation, and this can again cause prominence of the breast. Now, patients who come to us usually have none of these medical problems which are there in them, and they come to us because of psychological issues which is bothering them. Patients can also have gynecomastia because of medical reasons. When the patient comes to us, it could be because of issues of the liver, it could be because of tumors involving the testes, it could be tumors involving the pituitary, it could be tumors involving the adrenal gland. Sometimes it could also be because the patient is taking some drugs. And there are so many drugs which cause enlarged gynecomastia. This could be drugs like cimetidine, it could be drugs like digoxin, antidepressants, it could be finasteride. There's so many drugs. We have to rule out the drug history when we see our patients, do a thorough examination when we see patients with gynecomastia, because the medical issues need to be addressed, and if the patient is having a drug history, these drugs will have to be stopped, because some of the gynecomastias, they're very painful, they're very tender, they're very sour, and these patients require some attention, and especially those male patients who have nipple discharge, they have to be investigated in the form of a biopsy, investigated in the form of a CT scan or an MRI. So the main medical issues will have to be ruled out, drug history has to be taken, and these have to be stopped before even we have to start any treatments. But the medical issues are very, very uncommon, and the reason why we see the gynecomastia in our patients, the cause may not be known. So these are probably because of lifestyle changes, they can be because of hormonal excesses. Why this happens, we don't know. And we have to treat our patients because they are silently suffering psychologically. They are nervous. They don't attend schools. The boys, some of the boys which I know, they don't attend the classes. They are very depressed, and they don't communicate. They don't come out. They don't interact with their peers. And this is something which we need to address as plastic surgeons and get rid of the figure of having these massive breasts. Now, what are the treatment options available in gynecomastia? Now, you must understand that when we are dealing with gynecomastia, we have two components. One is the fatty component, which is there all over the breast, and another one is the glandular component, which is just below the areola. So the glandular component can be addressed by doing a simple removal of the gland, which is called a mastectomy, and the fatty component on the breast is addressed by what is called as liposuction, where we remove the excess gland. Now, there are also some new modalities of treatment which have been used by plastic surgeons, and the newer modalities like radiofrequency assisted liposuction not only help in removal of the fat tissues, but they also help in shrinkage of the skin, which may be excessive in these patients. So like I told you about the severe grades of gynecomastia, like grade 2 and grade 3, where you not only have the prominent glands, but you also have a lot of excess tissue or excess skin around the breast. So by giving radio frequency energy around the nipple area regions, it causes a lot of shrinkage and thereby helping in better contouring and more sculpted look in our gynecomastia patients. So this is something which is a new modality of treatment which we use in gynecomastia patients. You may be interested in knowing what is absolutely new in gynecomastia surgery, which we at Star Hospitals are actually doing for each and every of our patients. One such thing is radiofrequency assisted liposuction. Now, why are we doing radiofrequency assisted liposuction? Is because of the excess skin which may be present in the severe grades of gynecomastia. So when we actually do a liposuction, when we remove the gland, one may have an excess skin. So we want this excess skin to actually contract. So we apply the radiofrequency energy into the just under the skin and thereby enabling the skin to contract. The other thing, how we do it differently is we see the chest as a prominent area, which is a positive area, and if you see the sculpted mannequin, they also have negative areas. So we must respect these features in the male, and we need to keep some amount of fat over here, giving a prominent pectoral look, and at the same time remove all the fat below the pectoralis, that is giving a negative look. So in a gynecomastia, the common mistake is to actually remove a lot of fat over here, giving a very saucer-like effect. So this is what we don't want, and this is how we do things differently to enable us to sculpt the chest. Now, other thing which we do differently and which is new is to give a short scar. Now, around the areola, we give maybe around a 1 centimeter incision, and through this 1 centimeter incision, we remove all the prominent gland in the breast. And the third thing, how we actually we give a very natural looking appearance is through this short scar, we remove all the gland and we preserve 1 centimeter of fat above the underlying muscle. So when we do this, preserve the fat, there is no dimpling effect, there is no crater effect on the chest. So this is what which gives very natural results. And the final thing is, when we leave gland under the areola, it is just maybe around 2 to 3 millimeters of gland which is left, which gives a nice finish to the chest and doesn't make the areola look very prominent, and it looks very natural, very flat, and there are no recurrence rates because we are leaving a very thin nipple areolar tissue there, and it also enhances the blood supply and doesn't cause any disturbances to the blood supply and causes problems later on. So this is what we do differently for our patients, which gives a very natural result. Following a gynecomastia surgery, once a good lifestyle is maintained, the results last forever. So the gland, because of the physical removal of the gland, it never comes back, and because of a healthy lifestyle, the fat also will not come back. So a good gynecomastia surgery, a good proper lifestyle are bound to make the results last for a very long time. Following the gynecomastia surgery, we leave drains inside the chest, and these drains are usually removed after 1 to 2 days following the surgery. The patient is made to wear pressure garments, and this is going to be a nice snugly fitting garment, and the patient will have to wear this for almost 3 to 4 weeks. This keeps the patient comfortable, it keeps the fluids from actually really accumulating, and thereby maintaining a nice contour that we have actually given during surgery. Now, the patient is advised not to do heavy activities like gymming. Excessive use of arms is also restricted for this patient for at least 1 to 2 weeks. And following this 1 to 2 weeks, he can probably take up his routine activities, and maybe all these sporting activities and outdoor activities can be restored in 4 to 6 weeks of time. When gynecomastia is because of medical causes, let's say it's because of a liver cause, it's because of some hormonal issues, because of kidney effects, or it's also because of some tumors in the adrenal or in the pituitary, Yes, these can be issued. This can be covered by insurance. But if it's purely for cosmetic reasons, insurance would not cover. But medical causes leading to gynecomastia can be covered under insurance. A lot of things have changed over the past 2 decades. So gynecomastia surgery is something which we do it with a lot of finesse, and the state-of-the-art technology which we actually do. It is helping us to give a very natural, chiseled, sculpted look. So those patients who are silently suffering from gynecomastia, you don't have to really suffer, and you can probably come forward to us. We can assess you. We can rule out all the other issues which may cause gynecomastia, and then give you the state-of-the-art techniques. And once the operation is done, you really have a wonderful chest for you to actually enjoy and live a very confident life without any suffering.